Welcome to the Simply Compliance podcast. I'm your host, Craig Willard. We have a special guest today, Mr. Art from Breach Secure Now. I want to give a little bit of introduction to them, and then we're going to really beat up HIPAA. HIPAA is a really big thorn in some people's sides, but there are ways that you can absolutely mitigate the processes that are required to be taken when an organization is needing to meet the HIPAA regulations that have been out for many, many years. But Art is a serial entrepreneur. He has started 4 different businesses, including those in the IT space, HIPAA compliance, cybersecurity, and cyber liability insurance, which is becoming a bigger and bigger topic every single day. Art, welcome to the show.
Craig, it's great to be here. I'm thrilled, and I have my hands in a whole lot of stuff, but what's really true to my heart is HIPAA. I think the two of us maybe are some of the few people who really enjoy the HIPAA space and talking about it. So I think this is going to be a great conversation today.
Definitely. So let's just get started. Tell me about the state of cybersecurity when it comes to healthcare, and we talk also about HIPAA.
Yeah. In the past, organizations worried about HIPAA, right? There was like random audits and there was meaningful use, and you had to be HIPAA compliant. And those days are still the meaningful use has basically faded away. But the problem now is not the government coming in to audit you; it's cyber criminals coming to get your data, to make you a ransomware victim. And these data breaches lead into compliance issues, which we'll talk about. So healthcare is one of the most attacked industries, and unfortunately, it's the security in healthcare is probably not where it should be. And I think that's one of the reasons we're seeing healthcare, being ransomware victims, being data breach victims more than other industries. Are you seeing the same thing?
Yeah, we absolutely are. It seems like physicians are physicians. They open practices because it's a revenue generator, but they don't think really about the security aspect. They oftentimes use the same type of equipment that they have at home, or maybe they have that cable modem stuck that's running, DHCP across their network, and they think that everything's just fine. So it's a big deal.
And if you think about what happened in the last 10 years, we went from paper-based industry to electronic health records, and all of this digital information. There are no more paper-based records, right? Now, almost all of it is digital. So you have an industry that has so much, valuable digital information, digital X-rays, EHRs, telehealth, all of that information, and now you don't have you don't have compliance at the level that it's supposed to be. And then you also don't have security at the level it's supposed to be. So It is the perfect tsunami of why an industry is being attacked by cyber criminals.
Well, let's just take a small step back.
Yep.
There is often confusion regarding HIPAA and healthcare. And so there are a plethora of people out there and organizations that tie the two together at all times. Is there a difference between some organizations in the healthcare space and others regarding who needs to comply and who doesn't need to comply with HIPAA?
It's funny, when HIPAA was first introduced 20-something years ago, it really wasn't about privacy. It was really about information. It was insurance. It was, the HIPAA was to protect certain insurance type transactions, which, we don't think about it that way, but industries that take insurance payments, whether that's public, Medicare, Medicaid, or private, Blue Cross Blue Shield or Aetna, or, any of those insurance, those are regulated, covered entities. They have to comply with HIPAA. You also have business associates that work for healthcare organizations that have access to protected health information, patient information. Some law firms that are accessing patient information. So you not only have your hospitals and medical practices that are taking insurance claims, but you have their business associates that are regulated by HIPAA as well.
So
So
if HIPAA is attached to basically insurance reimbursements and things of that nature, what about those who are self-pay?
yep. It's funny. If you only take, cash, you theoretically don't have to comply with HIPAA. You're not a covered entity. You're not taking insurance. But what we see is a lot of entities that are, taking cash or non-insurance and self-pay. They still try to comply with HIPAA in the sense of still protecting that information, and they see that as a valuable, step of along the way. But theoretically, they don't fall under the HIPAA umbrella, which is interesting. And I think it's a lot of people don't realize that.
Yeah, especially in this day and age when we're talking about so much information being digital, whether it's an EHR, EMR, whether it's scanned documents from the last 30 years of health records or mammography, x-rays, or whatever it may be. When we think about ransomware, when we think about the penetration into the healthcare market, like what is that like from your perspective?
As I said, we came from a paper-based industry. So, you would pull the chart and you'd have all of a patient's history. If you think about ransomware, you got your ransomware 1.0, where it encrypted the data, where you can't use your EHR, you can't pull up records, you can't see what procedures a patient had, you can't see what drugs they've had, right? You have that, which really makes it very hard to see patients and provide services if you're a victim of ransomware. And then you have ransomware 2.0, where it's now stealing the data and threatening to release that data. Now you're looking at release of patient information. So ransomware is debilitating to an organization, because you don't even know what patients are coming to see you, right? I don't know if you heard about the doctors in Michigan who were hit with ransomware. They decided not to pay. And the doctor made an interesting quote. He said, "I just sat in my office and waited for patients to come in because I had no idea who was scheduled, what happened. I had to tell them, we don't have your records anymore." It was kind of interesting, kind of telling of how important digital information is to medical practices and hospitals.
Well, not only that, I don't know if that was the same one, but there was another one that was north, maybe around Michigan. It was uh, I'm trying to remember what what part of healthcare they were dealing with, but they got hit and they just said we'll close
Yep.
and we're going to walk out the door. And they think, I believe they think that when that happens, they'll just close the business and they're out of penalties and everything else, but they aren't. Is that correct?
That is correct. And in fact, I think the ransom was $6,000,
Yeah.
and they decided not to pay it, and then they closed their doors. I mean, it's a very odd case, but um,
It was an ENT. That's what it was. I think.
it
Yeah.
was exactly. We were talking about the same case. Yep.
Yeah. Yeah. It's so crazy. So when we're looking at the concerns of ransomware, when we're looking at this transmission of information in healthcare, what can Breach Secure now do to help the physician and the practice stay safe?
Yeah. Yeah. Well, everybody, when we talk about compliance, you absolutely have to train your employees on protecting patient information, right? You don't want to disclose information to the wrong parties. You want to protect the storage of that information, the access of it. But more than just training employees on the privacy rule and the security rule, you have to train them on cybersecurity, right? The biggest way, and the attack vector of choice is email and phishing. So if employees are not aware of phishing and of some of the scams that they on the social engineering that they may be a victim of, they're going to fall victim, and there's a good chance that there'll be a data breach or ransomware. So Breach Secure now spends a lot of time teaching cybersecurity, phishing, simulated phishing, dark web monitoring, and really getting employees to think beyond just protecting PHI from the standard way of complying with HIPAA, more how to protect yourself from being a socially engineered, or being a ransomware victim.
So have you built a package that is not only cybersecurity focused, but also the health, the HIPAA process. So does your tool offer the annual training that's required?
It does. In fact, it's basically a complete HIPAA compliance module and cybersecurity. So, we're training employees on annually on the privacy rule, on the security rule, and very engaging video case studies. We're doing annual risk assessments, security risk assessments which are required under the HIPAA regulations. We have security policies, privacy and security rule policies. And then we're doing cybersecurity, which is the phishing and the dark web monitoring and the cybersecurity training ongoing, because you can't train an employee annually and expect them to keep knowing what to do. So we put that all together in a comprehensive, pretty easy to use platform, and I think it's really being well adopted by our clients and our partners' clients.
Yeah, sure. So I came from HCA, which is one of the largest for-profit healthcare organizations in the country. And as a director of IT, I always did, and this was monthly and annual refresh or orientation for HIPAA. And one of the things I talked about was, if somebody calls you from an office that and they use a name, that there's somebody at that office and they're asking for information, if you're allowed to give the information, do you know that's really the person that, they may just be using a name from over there. So it's really important to know who you're talking to or who you are receiving communication with. Tell me how Catchfish does this from an email perspective, which I think it's so fascinating because it's so instant. But tell me about Catchfish.
Yeah, Catchfish is we think it's one of our most interesting products. It's an add-in to Office 365, so it runs on Outlook, Outlook Mobile, Outlook Web. And what we do is we analyze real emails. A lot of times, companies are sending out simulated phishing emails, and employees get tricked or they don't get tricked. What Catchfish does, it's actually an add-in. The employee will click the button and it analyzes the email. It'll actually go through and tell you the sending domain is different than the links. It has language that looks like extortion. It has there's pieces of that email that we use to train employees of why this can be dangerous. And we give, a rating of, this is very dangerous because these links are socially engineering links that we know of, or going to bad sites, but more the wording, it's general salutation. So it doesn't, instead of saying, "Hey, Craig," it says, "Hi there." I'm supposed to know you, but I don't know your name. And so we actually use real emails to train employees on, how to spot phishing emails, because that's the key. I mean, as IT professionals, we can read an email and go, this is not right, but a lot of employees don't know that. And as running an IT company, how many clients forward you emails? Is this okay to open? Is this legitimate? Catchfish automates a lot of that and trains employees along the way.
And you also give scores to your employees too, so you get an overview of of where you stand from a security perspective. Is that correct?
It is. In fact, that is part of our employee secure score. So that's one of the gamification that we have in our system, because after 10 years of training employees, we realized you have to make this interesting. You have to make this engaging. Sure. And so what we do is we give every employee an employee secure score. Think of that as like a FICO credit score, but it actually takes the employee security strength and it shows the employee this is based on certain metrics, how you do with training, how you're doing with phishing and your phishing fail rate, using Catchfish, acknowledgement of policies, what your score is. And what we do, we have a leaderboard. So we use 3 names. So employees actually compete. So if you're familiar with a Peloton or a Fitbit, there's that leaderboard, and employees really enjoy it. I mean, we get an angry email sometimes. My ESS went down 2 points. What did I do wrong? Which is great. That's exactly what you want. At the management level, we not only have the ESS, but we give every employee a risk level: high, medium, and low. So now, management can actually see, I have 10 high risk employees. I have 5 medium risk employees. So as someone who runs a company, a lot of times you have no idea your, employees, their security strength, their, how good or bad they are. This actually gives management a way of saying, hey, I have a lot of weak or weak links here, and you could start to look at what data they have access to, and there's a good chance they're the ones that are going to cause your next data breach.
So you've got the HIPAA policies, you've got the annual training, you have weekly cybersecurity trainings, you have the ability to instantly review an email to validate whether it's phishing or not, whether it's on your phone, in the online web access, or through Outlook, on the demand, right? And and then if you have questions regarding HIPAA or any of those things, does Breach Secure now allow for the consulting perspective of that, to where they can call you to get advisement or help?
And I think that's our greatest, one of our greatest features, right? Because a lot of organizations, they want to comply with HIPAA. They're just not HIPAA experts. And
Right.
even our partners are not HIPAA experts, right? They want to
Yeah.
help, they're supporting healthcare. They're not HIPAA experts. That's what we do really well.
Okay.
We are HIPAA experts. We've been in the HIPAA space for 11 years now. So if a partner of ours has a question, if a client of ours has a question, we get lots of privacy type questions. Can I send out postcards with, a happy birthday, or I got this request for information. What do I do with it? Or, in the unfortunate instance, OCR sent us this letter, and we need to respond to it. So we do provide that HIPAA help desk and really, advice, and we're kind of the outsourced HIPAA expert to
Sure.
organizations and our partners.
So you're basically adding staff without adding staff. That's
Exactly.
That's
It's like the IT world, right? You're
right.
adding IT resources without hiring IT. You're adding HIPAA compliance resources without adding that staff and that expertise also. Because honestly, there's not a whole, as there's not a whole lot of people that
Mm,
truly understand what HIPAA, what you have to do and what you don't have to do. And what you said in the beginning is very, very true. It's like, it's daunting until you actually realize what you really have to do. And then it isn't that difficult.
sure.
And so one of the things we try to do is we try to express it in ways that clients can understand. Like, what do I have to do? And steps, because no one ever, no matter how many risk assessments we've done, no one ever says, I want to be compliant tomorrow. Here's a checkbook, just make me compliant. And you can't do it anyway. But it's, what are the high priorities? Where should you focus? What are the steps you should take towards your HIPAA compliance? It's a journey.
There is no doubt it is a journey. It's a never-ending journey. It reminds me. So part of what our business does is this DoD contracting cybersecurity, or 80171 type stuff, which is now moving away from self-attestation into certification through the CMMC process. I just have this feeling that at some point that's just going to it's just going to start propagating out, and organizations, from a healthcare perspective and from a HIPAA perspective, do you think there will ever be a point where they'll require certifications for HIPAA versus self-attestation?
It's interesting. It's almost full circle. So if you think about HIPAA regulations, following NIST guidelines, if you look at what the states have done, Massachusetts, what New York has done, they basically took HIPAA and made it more general, right? So they
Mhm.
basically, and self-attestation, risk assessments, policies, training. But then now you're starting to get to certification. So I have a feeling that the next evolution will be certification, going back into healthcare. And instead of okay, we are doing this, and we say we're doing it. Now you're going to have to show what you're doing. So I think we're headed towards exactly what you said, and it's going to take a while, but it's eventually, after all of these data breaches, you're going to have to show that you are protecting. And I think it's going to be healthcare. I think it's going to be, at state levels, anyone who has PII or PHI is going to have to show that they are actually implementing those safeguards that they need to implement.
Sure. I also think that we're going to revisit this world where, if you remember when EHRs became the thing, and they were incentivizing organizations for moving into that direction, and you saw physicians going, "I'm out. I'm gonna just get bought up by the local hospital and become just a practitioner at their hospital and let them handle it. I think we may end up finding that we run into that yet again, where they're saying, I don't want to deal with the certification process and all this work that I'm probably not doing or that I'm not doing. And I think you'll find another exodus of business owners who are physicians.
Yeah, totally. And we're seeing it, having run at a HIPAA organization, we see a lot of churn, not because the clients don't want to, use our services, because they're getting bought by hospitals and they say, I just want to practice medicine. I don't want to run a business. I always look at my healthcare clients that successful business people, successful physicians. That's not easy. It's not easy to be good at both. I mean, not to say it's impossible, but a lot of physicians and in practices just don't want to deal with all of it because it's, you add HIPAA, you add insurance, you add, employee turnover. It becomes hard to run that business. And when you really want to focus on practice in medicine.
It's kind of like the doers in IT, right? So the doers in the IT space want to go start a business and they don't know anything about business and they really struggle because business mindsets are completely different. And, what they say, you chase two rabbits, you get neither. so, so, all right. So we've talked about this tool you have. We talked about the background, who needs to comply with HIPAA and who doesn't. When all else fails, I think it's really important to get into cyber liability insurance. And just from a personal perspective, so we have clients that'll send me, their little $1,300 or their $800 proposal from their insurance provider. And the first thing I see is there's no ransomware coverage or social engineering coverage. So tell me how important cyber liability insurance is and what people should really look for when they're looking to get a liability policy. What's important?
You hit it right on the head. The first big problem is most organizations think they have cyber liability insurance because they have the medical malpractice, they have general liability. And it turns out that, there may be some waiver or a rider on there, but it doesn't cover what they really need. And that's why we recommend standalone cyber liability insurance, because that will provide you with the resources that you need. And in a ransomware breach, and most organizations don't exactly know what that means, but in a ransomware breach, you not only want financial resources to pay the ransom, but that could actually be the least of your concerns, right? If you're in healthcare, Health and Human Services said that there's a good chance that ransomware leads to a reportable data breach. Yeah. So if you're part of a ransomware attack, you're going to need forensics to figure out which patients are affected, which patients aren't, right? You don't want to let everyone know if you don't need to. So you need forensics to know, who you need to report to. You need legal counsel to know what you need to do, how to comply. You need reputation management because your patients start posting angry and nasty messages on social media. That could damage your practice. News could write articles about you. So all of that could really hurt your reputation. And then a lot of organizations want to provide credit monitoring or some way of protecting those patients. So when we look at in cyber insurance, you want to make sure that it does cover forensics and legal counsel. You may not be able, ransomware may not allow you to operate or function your business. You may wind up losing revenue for days or weeks. Cyber liability insurance could provide replacement of that revenue. So I think it's really important to take a look at that policy and make sure that it's providing the coverage for you, not only financially, but also, some of the other resources that you may need if you become a ransomware victim.
It seems my experience anyway, that when you go to the guy that gets you car insurance or your homeowners and you ask them for cyber, they give you just something because they don't really have the experience. And I think that's a really big miss for insurance companies that can't really provide value in the sense that they say, look, you're making $3 million in annual revenue. You're going to need, a $5 million policy because it's going to give you $300,000 of this and $300,000 of that. who like do you have anyone that you know that could like help them dig through that?
Well, glad you asked that. Yeah, so that was like my fourth company. We started
Yeah.
an insurance company focusing on IT, focusing on medical, and really, I strongly believe, and you were just saying this, you need to understand cybersecurity if you're going to sell or consult with clients about cyber liability insurance. It's not the same as buying car insurance. It is specialized, and also you have to make sure that that the sublimits. Just because you have $1 million policy, you may only have $10,000 of ransomware coverage, or that doesn't cover lost revenue. You want to make sure that you are getting the right coverage. And one of the things about cyber liability insurance and talking to clients about it, you almost have to walk them through what a data breach or ransomware will look like to make sure that you're getting the right coverage. So I actually think cyber liability, that conversation helps with cybersecurity. And now cyber insurance providers, carriers, insurance companies, they're requiring proof of cybersecurity safeguards. So no longer can you say, oh yeah, we have a firewall, give me insurance.
Yeah.
We want to see multi-factor authentication. We want to see disaster recovery. We want to make sure that you're encrypting your confidential data. So we're starting to see the insurance carriers pushing on the clients to say, we'll insure you or we'll renew, but you have to, it's a shared risk here. You have to put cybersecurity in place, and then we'll provide that insurance.
It's like when healthcare started to ask questions about if you were a smoker or not. So, I mean, they go where the risk is. And, if you don't do these things, then maybe you're too high risk for that liability policy, or maybe they just don't use you at all. But it's a full package. And it's really, I think it's challenging because I think people whether it's, a hospital or a small practice or just a normal business, it's hard to think about the things that are being done to protect you in the background because you can't see them. It's not like the marketing guy that's helping you get 15 5-star reviews on Google and all these things. It literally looks like magic, and you even question whether it's even happening or not. And so it's a really hard concept for many business owners to accept. But in the healthcare space specifically, it's all about protecting that information. And it's funny. I always think if you really want to take care of your patients, part of taking care of your patients is taking care of their information.
Absolutely. And one of the things, and until you really experience a data breach, I mean, I've had doctors on calls crying, literally crying. These are, professionals, and they run businesses. They're like, this is going to destroy my practice. I don't know if I'm going to get fined. I don't know if it's going to hurt my patients. Until you actually have been involved in a data breach and ransomware, in that, the human emotional toll sometimes is worse than the ransom or the data breach itself. So, it really is. I always say, if I could just take someone who had a data breach and, bottle that and have a prospect, take a sip out of that just for 5-10 seconds and feel what that feels like, I couldn't sell enough HIPAA compliance and cybersecurity.
Is there a sublimit for therapeutic support when you have to use that insurance?
But a lot of times, just having the right insurance agent and the right IT provider, if you're in a data breach, you do need that, not therapeutic support, but you need help. And a lot of times IT people there aren't lawyers, they aren't
Right.
reputation damage. So it's really, from an IT provider point of view, also, you want to make sure your clients have cyber insurance, because the combination of you helping them restore the data and all that, and those resources that come with a cyber insurance policy, can really help that client. So, a lot of I recommend to IT providers, you have to make sure that you have those conversations with your clients about cybersecurity, because you don't want to be in the middle of a ransomware attack, and then your client's going to look at you and say, go negotiate Bitcoin payments. Most people don't know how to do that, and you don't want to be involved in that.
Well, and they may take you down too. So if you're the MSP for them, they say, look, that MSP has been doing all this work for me. I almost lead with, and we, as an MSP owner, we have started to lead with the question, are you interested in cyber liability insurance? Because if they don't see the value, if they don't see the interest in paying for something to protect them, the likelihood of them wanting to be doing anything more than just a help desk, they're not going to be interested in your cybersecurity processes and solutions because they don't even really care about the insurance. So to me, it's a leader. It's ask those questions.
The two of them now, as I said before, cyber insurance is going to help sell cybersecurity. Cybersecurity is going to help protect and keep cyber insurance rates reasonable. And you need both. You need no business, whether it's healthcare or any SMB, no business should ignore cybersecurity and cyber insurance.
And kind of wrapping up this cyber insurance perspective, and I know it varies. Some people will think they've got a really good policy for $800. What's a really kind of an average number? Let's say they're just let's say they're $500,000 to $1 million business a year. I mean, what should they expect when it comes to some sort of cost association?
It's interesting because if you were to ask me 6 months ago, it probably would have been 30% cheaper, right? And we're in a market where insurers are starting to pay out a lot, so those prices are going up. But in that general revenue, you're looking at $2,500 to $6,000.
Okay.
And I know it's a wide range, but
Sure.
it depends on the coverage. But but I hate to say it, that could be $4,000 to $10,000 next year. You know what I mean? And
Sure.
you really, as more and more companies are saying, I need this insurance, and more, ransomware attacks and data breaches, it's becoming more and more expensive. But that's probably a good estimate of what a reasonable policy would be.
Yeah. Well, they'll want to pay 300. Can we do that? I said they'll want to pay 300. Can we do that? You definitely do. So, in wrapping all of this up, we're talking about healthcare. We talk about HIPAA. We talk about cybersecurity training, being able to look at phishing elements potentially on the fly, cyber liability insurance. Is there anything else you want to leave as a parting gift to healthcare organizations that are needing to get themselves in the right direction?
It's funny. A lot of organizations, and I hate to say it, we're talking about compliance, but they basically said, you know what, there hasn't been a whole lot of enforcement, some really big cases, and that only happened to big practices. But the truth is, data breaches are the lead in to OCR to investigate your compliance. All right. So even though you may not randomly be audited, a data breach could lead into an investigation. A patient could file a complaint, an employee can file a complaint, or a disgruntled employee that left. So you can't ignore compliance. You can't ignore it because anything can open up Pandora's box. And then you need to prove that you have that compliance program in place. And you can't ignore cybersecurity because, being a ransomware victim and a data breach victim and having all of that emotional pain and damage to your practice, really important. So I really strongly urge that organizations take a look at what they need to be compliant, then also take a look at what they need for cybersecurity. And truthfully, it's not that expensive and it's not that complex if you have the right partners to help you with it.
And you may, this as my final question, you may or may not know this. Is there any sense of potential forgiveness through the OCR regarding violations when people have done everything that they could have done and they may have missed or may have been a little low in an element, particular element? Do they give some flexibility?
Yeah, they do. In fact, they just passed a safe harbor law. Basically, if you can prove that, and it's still in public discussion, but
Sure.
they're getting to the point where if you can prove that you've implemented the right safeguards, that you are HIPAA compliant, that you have tried to lower the risk to patient information, then a lot of times they are saying we're not going to penalize you because you can have data breaches. Any organization can have a data breach. But on the other hand, if you've ignored everything, that's when you're going to be in trouble. So yes, we're starting to see, let's put the right safeguards in place. Let's take HIPAA seriously. Let's take cybersecurity seriously. And then, that's a great way of, minimizing the potential damage to your company.
Yeah, I think that's a great way to end. I greatly appreciate your time coming on, and I look forward to maybe having you back on again. We'll talk more about this because HIPAA is a big thing, and I would guess compliance is probably in the teen percentages across the country. There's a lot more to go, and hopefully you're providing a solution that people can recognize actually makes a massive difference in their business. Thank you. Thank you. Thank you.
Thank you. I really appreciate it, Craig. I had a great time, and I will come back anytime. Thank
All
you.
right. Thanks. Have a great one.